Welcome to the ChiroSphere podcast, where we talk about all things chiropractic and some things not so chiropractic. I'm Dr. Ray Foxworth, founder and CEO of ChiroHealth USA. Today, we're honored to have Dr. Scott Munsterman with us. He is the founder of Best Practices Academy and co-founder of Chiro Armor. Dr. Munsterman has dedicated his career to equipping chiropractic practices for value-based care, collaborative healthcare models while being compliant. His impact spans beyond the profession, having served as vice chair of Northwestern Health Sciences University, a state legislator, and even as mayor of Brookings, South Dakota. With a wealth of experience in policy, leadership, and practice transformation, Dr. Munsterman brings a unique perspective on the future of chiropractic and integrative healthcare. Most importantly, Scott is a dear friend of mine, a mentor, and someone he is one of my go-to guys. So, Scott, let's dive right in, all right?
I'm ready.
All right. So you've been a strong advocate for transforming chiropractic practices into what's called value-based care models. So for some that may not know what value-based care is, how about kind of give us a little overview of that? And what are the key steps that the practicing chiropractor needs to take to prepare for this?
Well, value-based care in the third-party reimbursement world means that we get paid on outcomes. I mean, that's kind of the general thought pattern. Now, this has been a migration and a continual journey on the value-based care system for quite some time. It's probably been a good at least 10 years, maybe 15 years. And it started with the advent of, if you remember back in the, well, probably almost like 20 years ago now, patient-centered medical homes and accountable care organizations kind of came into being. We heard about those. Well, all of these things are still actively engaged, like in the Medicare system, but it's primarily in the medical side. But there will be some point, I believe, that fitting chiropractic into those models, which we do see in integrated healthcare models, whether it's inpatient, outpatient types of settings, it's going to be a part of that value-based system, in the future, and some of it's probably even occurring today without us realizing it.
Is that what's occurring, or does that occur in the federally qualified healthcare centers?
That's really a great example. Yes. And if you look back over the last 5 to 10 years, how chiropractic has really taken a great step forward into that integrated approach. And what's really interesting, because I work closely with some of those FQHCs, with our colleagues in those settings, and it's the introduction of chiropractic in that particular example that you gave with the FQHCs. That's a chronic patient population. I mean, they have all kinds of stuff going on with them and a multitude of different factors and high risk adjustments that are made because they're in a very high hierarchy of care that they need, complicating in lots of different providers and specialties and all that. And yeah, we are being represented more and more every day in that model of care. So that's a great example, Ray.
So I've heard that a lot of those federally qualified centers are actually looking for chiropractors because, let's face it, if you want to pay any group based on outcomes, look at chiropractic. We ought to be being paid top dollar. And I think the value that we bring as chiropractors to those types of centers, let's face it, they don't have the type of outcomes that we do in PT or the average family practitioner or nurse practitioner or whoever's seeing those patients. So my reason for bringing that up, docs, is, when things like this come along, we have a tendency to say, oh my gosh, we're going to get killed by that, crushed by that. Man, this is an opportunity for us, I think, as a profession to absolutely shine. So, I feel like we ought to embrace that.
Yeah, for sure. And I've said for years too, we have nothing to be afraid of here. We just have to be prepared, and understand when those opportunities, as you mentioned, are forward, us being able to respond to that, because as you know and have mentioned that, I mean, we've got clinical outcomes on our side and we have patient experience outcomes on our side, high ratings in both in what we do. Yeah, there will be a time will come and is coming, and I feel in many ways, we're seeing some of that, show today.
Well, if you'll get your Walmart crystal ball out for a minute, and when do you think we might start seeing value-based care occurring at the actual clinic level, individual practices, whether it's MD, DC, PT. Is it on the horizon?
Well, it's been on the books for years, as I mentioned earlier, and it's been more in the inpatient model, hospitals. Well, that's where the AC accountable care organizations were, they're given X amount of money and they got to figure it out. And so then they're designing a lot of different types of protocols to help manage their population of people that they're taking care of, their health, and there's preventative measures and some of those things that typically we wouldn't get paid for, but they're deployed in that model and they save money. And so all of that is being tested and worked on and reported on and paid on and all of that. And so to me, it's just a matter of time, whether it's 5 years or 3 years or whatever. And by the way, that could be expedited based on even from a political leadership perspective. If you get somebody in there that says, "Oh, we're going to do this now," and then it gets done now. So there could be a learning curve that could come to us fairly quickly, depending on what sequence or series of events that could precipitate it, coming into our setting. But a lot of those models have been worked out, or being tested, are being proven successful in a number of different ways.
Yeah. So my takeaway from that is, even though it may not be applied to individual practices right now, let's face it, we want to get patients the right care at the right time and at the right cost, and that is truly where chiropractic excels. And so, really we ought to be doing those things anyway and improving our outcomes, because let's face it, that's what gives us our patient satisfaction. So whether you're being reimbursed based on that is really kind of irrelevant. If you just want to render good service to the public and have good outcomes, go ahead and take those steps that you might take if you were involved with one of those facilities.
That's
So
great advice.
let's transition a little bit. We're seeing more and more collaboration between chiropractors and other healthcare providers. I certainly that was my model of my practice for a number of years, being a part of a spine center, and I would not personally want to practice any other way. What strategies would you recommend to chiropractors who want to build a stronger relationship with the broader healthcare community? Where do you start?
Well, as you alluded to, Dr. Ray, I've had 13 years experience as an elected official. Okay. And so I always go back to that, and it holds true no matter what you're doing, but it's all about relationships.
Amen.
And there's 3 key steps in a relationship. You got to know that person first, or they need to know you. Then comes they will like you, they'll like you. And then the third step is trust. And so it is just that simple. And so it's, getting to know that, those specialists, those other healthcare providers that really are within our portfolio, if you will, of who we want to go to for our patients' needs, for specific patient needs and all that we can co-manage with, maybe that patient care, or maybe it's a direct handoff, to those providers because it's something we're not going to be involved with. But there's a number of ways we can work with other healthcare providers and medical practitioners, and there's a wide variety of those, that we can work with. But it all boils right down to having that relationship, with that individual, and then them getting to know you and like you and trust you, and there's a certain time factor with that.
And guess what, docs? You can't do that sitting behind the desk in the 4 walls of your office. It just doesn't. It doesn't work that way. You can do some things in that setting, but I just share briefly. My experience. I sent out 11-page letter to 350 MDs when I got pissed off right after the Wilk case settled, because I couldn't get hospitals and other doctors' offices to release medical records. And it basically said, here's my background, here's my training, here's when to refer to a chiropractor and when to never refer to a chiropractor. And I sent it out, and I got a couple of phone calls. Don't ever send me anything again, you damn chiropractor. And I said, okay, you're off the Christmas list. But literally within a week's time, I got invitations, one to River Oaks Hospital, ultimately to University Medical Center. And I mean, truth, scared the bejeebers out of me. It's like, damn, I didn't know they were going to ask me to come talk to them. But by doing that, what I found was no other chiropractor had ever reached out directly to them like that. And so, the responses I got were, I know I have a lot of patients that see chiropractors, but I've never known one. I've just never knew anybody. And so I like to tell docs every time I get a chance, show up, say yes, get out there, get out of your comfort zone a little bit. Because let's face it, 120 some odd years into this, we're still seeing that 15, 18% of the population. Guess where the rest of them are? They're going to a place where they get opioids, where they don't get the outcomes that we do. And we really can position ourselves as a problem solver for those other practices. I mean, can you imagine as an MD or family doc, the frustration with dealing with back pain patients? You're going to get them out of there. Typically, it's a referral to PT, and it'd be much better if they were referring to chiropractors.
Yeah, that's great advice. I mean, and you can't do that through social media. I'm sorry.
No,
It is just like this. It's face to face. It's getting to know people, letting them get to know you. It's funny because I've been in chiropractic 40 years now, and I know you're right there with me, if not a shade more or less. And that's the way it always has been. For us, our generation, and I know that we have new ways of communicating these days, and I'm not discounting them one bit. But when it boils down to trust, because that is the end goal here, trust. They need to know you and like you, and that's when they begin to trust you, and you trusting them. So it's a two-way street. And so the only way that I can see that you can really accomplish that has been the way that you've done it, I've done it, and others have done it. And that's just having that one-on-one direct relationship. And maybe it's not taking them out for lunch, but it's stopping by to see them and say hi and say, hey, here's who I am. Here's what I love to do in my practice and focus on, and whatever. I mean, however you roll that out. You did it in a letter, right after that event occurred, which that was a great way to get a foot in the door and then take off from there.
Docs, if you don't do anything, this was just part of the way that we operated, and the reason that I ultimately ended up being invited to be a partner in that spine center was because I did choose to communicate with primary care providers. So, on our patient intake form, who's your family medical doctor? And during the consult, we would, we would tell them, Ms. Jones, I see you see Dr. Kelly. Well, we like to keep them informed of what's going on with your treatment here. Do you mind if we send them a letter about your condition? And most of them are okay. There are a few, 20 years ago that, oh no, don't tell my medical doctor I'm seeing a chiropractor. But literally just a simple letter that says, hi, Dr. So-and-so, I want to let you know we're seeing one of your patients, Miss Sunshine, and she has this, this, and this. We're going to treat her for, 2 weeks and reevaluate. I'll keep you posted. And then 2 weeks later, we'd do another outcomes measurement. We'd be able to show their pain went from a 10 down to a 4. Their oswestry went from a 62 down to a 22. And we would do that probably twice during the care of that patient. And what that does is that creates top of mind awareness in the medical doctor's office, because he sees his patients getting better, and it brings you into the conversation when the patient's in their office. And Scott, what I found was when we got too busy being busy and stopped doing what was working and weren't getting those letters out, guess what happened to my referrals? They went down. And as soon as we kicked the letters back in, they went up. So, just providing, and don't send them a 5-page narrative, just a short and sweet, hi, this is Dr. Foxworth. I want to let you know we're treating Ms. Jones. She's got this, this, and this. Here's where she started. Here's where she is. Love, Ray. I mean, 1-pager. Bullet point it when you can, because everybody's got so much information they're trying to consume.
Yeah, and they don't need to know where you found subluxations.
No, they
They
no,
don't,
they
and
didn't.
like you said, it's short and sweet, and hey, if you have questions, would love to communicate with you. This is where, and my treatment plan is going to be this, but just being very, high level on that. You had mentioned earlier, and this might detract us a little bit, but I got to kind of tell the story, and you have a ton of them too. But back in the days when you and I started, of course, you talked about the Wilk suit, and it was shortly after that when I got started in practice. Uh, the medical community wasn't exactly arms open, right? Uh, so there in my community, when I started practice, there were two prominent MDs that were like the top dogs, in the medical clinic, kind of thing. And anybody that would come in there, if they said they were going to a chiropractor, oh my word, they would rip them wide open. Uh, and so now fast forward probably 25 years, 20 to 25 years. I get a call, and it's from the retired MD, one of the ones that were just mad dog, towards the profession, asking me about shingles, zoster, herpes zoster, and it had healed over, scarred up, for him, and he had chronic pain. He was wondering, if chiropractic and acupuncture could help him. On the phone with him, and I told him I did acupuncture, and I just said, I said I get about a 50% response. I lowballed it big time, and I talked to him about it, hung up, and I thought, well, that was interesting. Lo and behold, guess what? He shows up in my office. And what was really funny about this whole thing, and he got great results, okay, but what was really funny about this whole thing is that he had to sit in my waiting room filled with patients. He saw me probably 10, 12 times during that whole treatment time, and he sat there, and you would not believe the looks on people's faces when
Sure.
they would come back to my treatment rooms. Their eyes were as big as eggs. I mean, they were like, "Oh my gosh, do you know that Dr. So and so is like in?" I'm like, "Just lay down, Sally. We need to get to work," because that. And the other MD, by the way, when he retired about a year later, came right into my office and asked to see me. And one of the things very first thing came out of his mouth, he apologized to me. And
Mm-hmm.
he's like, "I had no idea, when I was in practice, the value that you guys had." And then he was telling me that what you need to do is you need to go. And I built my clinic right across from the medical clinic when I was
There you
right in their face, and the hospital's right there. And so he was pointing, he's like, "You got to go back to my colleagues, and you need to, go talk to them." And I'm like, "You know what, Doc? I'm happy to show up anytime." I said, "But really, you need to go talk to them because you're the one that led this whole thing against my profession and my colleagues and the care and all that." And we had a friendly discussion about that, but it just kind of points to where we've come from, to a large degree. And now many of the medical practitioners, whether they're nurse practitioners or PAs or MDs, they've had chiropractic care. Many of them have, in their daily lives, or they have family members that have. At least in the state of South Dakota, over 50% of the people in the state have had some form of chiropractic care in their lifetime. And so that's a pretty neat statistic. And so anyway, I deviated a bit from that, but you brought out a story in my mind that I just had to kind of get out there for you.
Yeah, I think there's a lot to be learned from stories. One of my favorites is I probably a year after I'd started, really getting involved in the medical community, I got invited to speak to the pain management physicians at University Medical Center, and they have their grand round. The talk was at 6:30 in the morning. Okay, so here I am in an auditorium style with all these anesthesiology residents who are going into pain management, and I'll never forget Dr. Ike Aerator, who was a guy that invited me in. So I gave the dog and pony show about, the importance for a chiropractor to have pain management docs that they work with, whether someone needs a lumbar epidural injection or an SI injection or whatever it may be, basically to lay the groundwork for when they go into practice, they need to find a chiropractor that they can work with because, most pain management docs know that if you just do a steroid injection and you don't follow it up with physical treatment, that you might as well just be shooting the juice out the window, so to speak. So I get through with this talk, and then Dr. Aerator stands up. He says, "I'm just curious. Has anybody in here ever been to a chiropractor? And it was dead silence, uncomfortable silence. And then finally, this one guy stood up and says, "Hi, I'm Bob. I see a chiropractor." And the next thing you know, another one. And literally about half of those residents at some point in time had seen a chiropractor, but it was just so damn funny when it happened. I really enjoyed that one. So let's talk a little bit about the compliance side of things. I know you're co-founder of Chiro Armor, and you've been at the forefront of helping chiropractors stay compliant, my practice included, for a number of years. How about a short overview on what Chiro Armor is, and what do you see as some of the most common pitfalls that we're making in chiropractic when it comes to compliance?
Well, we saw the need and to be able to wrap around the chiropractic practice a comprehensive compliance program. Many times docs think, oh, compliance, it's my documentation or it's Medicare this or whatever, because they don't have like the full spectrum of what is involved with compliance in the healthcare industry. And so we have to really kind of back out and say, okay, what regulates your business as a healthcare business? Doesn't matter if you're a cash practice, whatever, XYZ, it makes no bearing on it whatsoever. And so the federal regulations, as we're aware of, we've got employment law that gets wrapped around that. We've got our HIPAA, privacy security, rules that wrap around that. We've got OSHA that wraps around that. We've got other federal regulations like your Stark law and any kickback and false claims, and then you have to peel back the next layer off the federal, and you have your state. And of course, you have licensing requirements because within your scope of practice, and then other types of state regulations that could impact you, like unclaimed property, laws. And so there's things like that all of us, none of us, I should say, had that kind of education in our colleges, because it is there's a comprehensive set of rules and regulations out there. And so we saw the need to be able to bring that to the chiropractic industry, to protect them, to protect our colleagues and protect the future, and really, to build a legacy around that, so that, many of these healthcare facilities that have the administrative, power, I mean, the manpower, if you will, or human resources to watch all those things, whether it's a hospital or a large medical clinic or even, smaller scale medical clinics, they have people in charge of that. And our solo docs, or maybe 2-3, DC docs, they don't. I mean, they're trying to handle these things themselves. And again, they don't know what they don't know. You've always heard that statement over and over again. And so we bring that to the chiropractic industry. We want to make sure that we can wrap around protection around them. And so what we did was we looked at all of those rules and regulations, federal, state, the whole gamut. And then we put together a system that helps not only get them prepared in their policy and procedures, and then keep those updated, because believe me, that is a work in progress on the compliance level from those federal agencies and state agencies of how they interpret things, and all of a sudden there's a change in a rule or whatever, that's got to get right, updated in the policy and procedure. So we not only do that, though, to keep them up to speed on that, but then we lay out what's called a monitoring and auditing process, which is what's required by the Office of Inspector General for all healthcare facilities. And that means that we have a checklist that we go through every month with those practices to make sure that we are compliant to the policy, which is compliant to those regulations. And then we do have a hot target analysis, Dr. Ray, that we work with clients right away initially. And so we're looking at their level of documentation that they're doing today. How does it match or does it meet the needs of what's required to document? Not only for reimbursement purposes, and this is a focus of mine when I lecture, it's really about documenting that you perform to the standard of care. At the end of the day, that initial visit, there's requirements that we as providers need to fulfill, taking that comprehensive history, figuring out what are those chief complaints, evaluating those chief complaints, arriving at a diagnosis, a differential diagnosis, making a referral if we need to make a referral, developing a treatment plan, ordering imaging or other diagnostic labs, and then moving forward with our treatment. Well, yeah, there's documentation requirements to show that we did that, but really we're documenting to what we're supposed to do, and we do in our practices. And so we look at that and we weigh that out. I find many times, and I'll hit a few top targets here, but there's many, but the ones that I see the most that we're at risk for when I bring on new clients, number one would be documentation. Number two is their informed consents. They're sometimes fairly horrific, as far as what that they don't include the essential components that are needed, number one, in an informed consent form. And then number two is the process by which that informed consent is delivered. And they're totally off in their process, and so and especially with the advent of a number of different types of modalities that we see out there that do different things, that have different contraindications for, we need to make sure that those have informed consents as well, because they are a different procedure than just manipulation or traditional modalities may have. So those are some of the key things. And then maybe not understanding, how to utilize like an ABN form and, and some of those things. But I'll pause there, Ray, because you know me, I can just like go down a rabbit hole on this.
Yeah, literally just yesterday, I like you get a daily download from the Department of Justice, and literally yesterday or day before, one of the top cases that they went after were a couple of chiropractors, I think, in Rhode Island, and what they got them for was they failed to have policies and procedures for their clinic. Now, they audited them for something else, but when they dug into it, I think some chiropractors think, well, of course I'm compliant. I bought a 3-ring binder and it's still in the plastic wrapper on the top shelf. That is not compliance. As a matter of fact, that's knowingly and willfully violating all the rules and regulations, because you knew you were supposed to do something, but you really didn't do anything. And I try to, when I am a recovering medical compliance specialist, so it's just a full disclosure. And, I would explain to doctors when I was doing that, compliance is not an event. It's a process, and it is an ongoing process. And what I found in my practice was the more compliant I became, the more profitable I became, because we were missing things that we weren't charging for and should have been. Or, let's face it, you got a busy day on the books and a patient comes in, they've got a lower back issue, and all of a sudden, almost on the way out the door, they say, oh, by the way, I fell down the stairs last night and I hurt my neck. Would you check it? And you check it and you say, oh, I think you're okay. Well, you just did an exam and you didn't document it, and you probably didn't bill for it. And so when you start looking at, the end of the day, you look at your day sheet and you see what all the charges were and who you saw, you say, oh, wait a minute. I would routinely, at the end of the day, have my staff bring me the day sheet, and I would go through it and just kind of do a mental check off. Oh, wait a minute. I've been treating Miss Jones for neck and back pain. Her neck is doing great. I didn't adjust 3 to 4 areas today. I only adjusted 1 to 2. But we're creatures of habit, and if you salt, same as last time, all of a sudden you build for a higher level of service, and that's an OIG. That's a problem. So what I would do to document that is I would just simply internal email, send an email to the front desk staff. Miss Jones did not get a manipulation 3 to 4 areas. It was 1 to 2. And so now I've got a paper trail of, I found a problem, I took corrective steps, and we made sure our billing was accurate. And just something as simple as that. Number one, it's going to make you stay on top of your game, make sure you're billing out what you should, make sure you're not missing things you should have billed for. And compliance never feels like a positive thing. It feels like a negative thing. And I think it's because the lens we look through. Now, the reason I'm a recovering medical compliance specialist is compliance can be a very negative thing for an office. And most doctors don't like the paperwork and don't like doing it. So what do we do in our infinite wisdom? We hand it off to a CA who has no background, no training, in compliance, and they are responsible for keeping our practice protected. You might as well go hire Bart the mall cop. I mean, so that's why I chose at that time to outsource our compliance, because it takes up anything that takes away from patient treatment time is costing you money. And if you're not really good at it, or you're not a geek about compliance, it can be an emotional drain, a physical drain. You've already got enough other stuff to do. And so that's what was attractive to me when I first found out about Chiro Armor and got involved with it was, wow, 90% of this stuff, I can have somebody, I mean, it's no different than outsourcing your billing. You can literally outsource your compliance to a compliance officer. Let's face it, if I'm supposed to do self audits and I find something I did wrong, I'm supposed to self report. And honestly, how many people do it? But if I'm using an outside compliance officer and I'm doing something wrong, they point it out. I can document I took corrective action and sleep a hell of a lot better at night than if you're trying to do all that crap, just in house.
Yep.
So what do you see in, I know the OIG comes up with their annual report and things that they're going to look at for the upcoming year. What are they looking at and that applies to chiropractic for 2025? Any changes?
Yeah, well, they are looking ahead at different, number one, looking at the different professions and what are the specific requirements that they feel should be met. I mean, this is a work in progress for them, and they've been working on it actually over the last year. There, you will see more to the forefront, patient safety. The prevention of medical errors is big on their target list. They've actually written 17 reports in the last 10 years about medical errors and the cost of Medicare and all of that. And what's interesting is that isn't just all inpatient, medical stuff. I mean, I think it's 57% are directly related to outpatient, and so we're going to see more of a focus and trend along those ways. And then they continue to try to work on their error, and what they see out there in their documentation reviews and audits, and they're focusing on some key areas, right now, and it's primarily medical interventions. So yeah, so there's going to be, there's always, as you know, Dr. Ray, a work plan that they have and they put forward and they work towards. But as far as the things that I think we'll see bubble up at some point are going to be more specific program type requirements, if you will, compliance program requirements for different disciplines. And I think what we'll see, based on what I've read, more direction towards patient safety as a whole, and some requirements there. So we're very well prepared in both of those areas, and already do some of those things in our policy manual already.
Well, hang tight, everyone. We're going to take a quick break to hear from our sponsors. Welcome back to our podcast with Dr. Scott Munsterman. Scott, you kind of had a unique career spanning healthcare, education, public service. How did your time in government shape your approach to chiropractic advocacy? We all go to the NCLC they used to have, and go to the Capitol Day in the states and also on the federal level. Since you've been on both sides of that, what advice would you give to the profession of how to approach your legislators when you are advocating for the profession? Threaten them? Take a bag of cash? What do we do?
Well, cash is never a bad idea. Even a roll of stamps is a good idea. Even a roll of stamps will work. We kind of talked earlier about, the formula, know, like, trust, and really that it boils right down to that. Get to know your state legislator. One of the things I work into my lectures when I talk about ethics and law and some of those things, I work in a few slides about this subject. So it's really interesting you're asking me this question because I ask the whole audience, how many of you vote? And then I ask some of the basics of government. What are the three branches of government? And some of those things. And it's kind of eye-opening. Many of our colleagues aren't paying attention to those things, and so it's just off their radar, and I get that. I mean, but the point being is that get to know that person, that legislator, take them out for lunch, or go over and just say, hey, a cup of coffee or something. Again, face to face, talk to them, and then write them a check. I mean, even if it's, a small amount, go help them, with their campaign, prior to them, the vote coming, or election day. There's a lot of work that has to be done months prior to that, and maybe helping them get their name on a ballot, with petitions and having them signed, and, and just being in not, to forget about saying, become, make sure you're registered as a voter. I don't care which party you're in. I could care less about that. And believe me, they could really care less as well, unless, it for some reason matters to them. But it's just really activating and getting out and getting to know them. And then the other thing I want to say is that, how we are trained as chiropractic physicians, we have a very holistic way of looking at things and looking at the big picture, and then being able to figure out how the things work inside of that. We're great for public policy. I mean, the mindset that we have, that we've been trained on, and how we view problems and how we look at situations, that's honestly, I mean, I saw that as just a huge strength that I was able to bring into my caucus, into the legislative body as a mayor, and just into those situations, because there's complexity in public policy, and that's really what we're driven to do when you're elected, is to make the best decisions for the people that you're representing at the end of the day. And so just keep that in mind too, that if you feel like that's something that you're being drawn to do, like I was, and it is a drawing or a calling or whatever you want to call that. But it's like, no, I guess I need to get involved. I don't know why yet, but it looks like I need to help, and it all kind of begins with that intuition, if you will. But yeah, let yourself go that way, and to become involved with that. But that really is the key. It's all about relationships, them getting to know you and like you, and then trusting you and you trusting them. And it's amazing what you can do in those situations, whether you're actually elected or helping people get elected. Prior to my being elected and serving for 13 years in different roles, I was a go-to person for key legislators in our area, because I got to know them personally, and that largely came out of when I participated in our state association. Which, you know what, if you want to start somewhere, start in your profession. Contribute to your profession. Join your state association. Join a national association. I've been a member of a national association. Okay. Ever since day one I started practice, I could not afford to do that. But I remember writing that check.
Mm-hmm.
And I was like, oh my gosh, it was $400 a year at the time. And this was back in 1985. It could just as well have been $4,000, because I barely had $400. But it just really gnawed at me. Who's going to represent me? I can't do it. Back then I couldn't do it, but that was something that we all have to really engage in and say, you know what, they're not going to be perfect. They're going to make decisions that I don't agree with, but you know what, I need to support them because they're supporting our profession in general. And if you don't like something, then get involved and get in there and have a voice. So if
Boy,
you can tell, I've got some strong feelings about this.
we both do. Often told doctors, the time to reach out to your congressman is not when they're already in Congress. The time to reach out to them is when they're running for dog catcher or city alderman,
Yes.
and go and grow with them along the way, because there's hardly anybody that goes into politics that doesn't have the next office in mind. So literally, I mean, we helped Greg Harper, great guy here from Mississippi, ran for the House on the federal level, and we literally stuffed envelopes for him. Our association was the first one to endorse him.
Yeah.
And when the Medicare modernization bill was coming along, and I went to Washington to advocate for him, his literal words to his chief of staff was, "This is Dr. Ray Foxworth. Give him whatever he wants." And I went, holy cow.
Mm-hmm.
And it wasn't because I had donated hundreds of thousands of dollars, but I did donate, and we did get him before our association, and we did help stuff envelopes, and we did get our profession, the members of our association, to send out a letter to all of their patients that, I'm your chiropractor, but we're also involved in politics, because the reason you may have limited benefits or whatever is because of policy, and we need you to vote, and this guy is on our side. So, just simple things like that really endear you to the politicians. If you've never shown up and they don't know you when you walk in the door, the likelihood of you getting them on your side it's really slim to none. So build those relationships early. Um, the other thing is, if you're not inclined to get involved personally, there's an army of chiropractors that are involved with their association that are willing to do the work. And I'm feeling like I'm a Johnny One Note here, but when I see that less than 25% of our profession belong to either national association, and only about half of us belong to our state associations, and we wonder why we're where we are and stuck where we are and we can't make the progress. It's because 75% of the profession is sitting on the damn sidelines waiting on something. What that is, I don't know, but for those that are tired of waiting and sitting on the sidelines, go check out the Chiropractic Strategic Plan. We are heavily involved in that. Scott's involved in that, contributing to it. And it does not take the place of ACA and ICA. I want to make that clear every time I bring this up. They can only do what they can do with the membership they have, and we have got to get the rest of the profession to come around them when they're promoting pro chiropractic legislation, and they can only do so much. Well, we're involved in research, we're involved in governmental affairs, we're advocating for the profession. Just some unbelievable accomplishments that have occurred over the last 3 or 4 years. So go check that out. I heard, I think John Murray, one of the guys that's involved with the chiropractic backpack sidebar. You realize we've never had a super PAC in chiropractic, to where companies and corporations could donate to a political candidate? Well, now we do, because of the strategic plan. But his position was donate $50 a month to your backpack, $50 a month to your state PAC, join your state association, contribute to the Foundation for Chiropractic Progress. And yes, I'm on their board, and I think you should support them and contribute $50 a month to the strategic plan. That's $200, basically $200 a month. And now you've got people that are willing to show up, take time out of their office, go to Washington, go to the state capitol, and advocate on your behalf. We've got to tap into why other chiropractors. Let's face it, the majority of our profession is not on board in advocating and supporting the profession. And I mean, this is a plea. I mean, I'm asking you, I am begging you. Our future absolutely depends on it. And if we get sick and tired of being sick and tired of where we are, maybe we'll step up and do something. So I challenge you, docs, not in a negative way, but I encourage you and challenge you to get involved and at least support those who are advocating day in and day out for us.
I agree, 100%.
So looking ahead, what do you see as the biggest opportunities and challenges for us in, say, the next 5 years?
For our profession?
Yes.
Really, I think from the standpoint of protecting practices, I mean, that it has just been such a focus. I see that we have, some major weakness in that area, having practices that have compliance, true compliance wrapped around them to protect them. Hands down. Number two would be to continue to do the good work that we do with patients and uphold to our standard of care that as it's dictated within our state, guidelines and licensing board and all of that, and being mindful of the ethics that are involved with that. I mean, just staying really true to that. The vast majority of our colleagues are in that purview, and making sure that we continue to monitor patient outcomes and put the patient first and all of that. And then number three is be open to other business models that may come forward. I mean, whether it's based out of the third party pay system or not, or whatever. I mean, every practice needs to try to do everything they can to be economically viable, and depending on your economic circumstances in your region, in your town, in your community, there's different decisions that practices need to make, based on that. And there's challenges there, and so to continue to really work towards that, to become a profitable business, from an ethical perspective, again, compliance and ethics and patient focused, and then, how do we need to create that business model to maintain that viability? Those are really key factors in my mind that we need to really stay true to, keep our nose, our head down, and continue to move forward on. And we will have more opportunities that will come our way because of
it reminds me of our company's core values: do the right things for the right reasons in the right way. You'll never go wrong doing that.
right.
I want to go back to something you talked about, trust, what I think is so critical. There's a book that was written by, it wasn't Stephen Covey that wrote it. He wrote the 7 Habits book, but his son wrote a book called The Speed of Trust. And it talks about whatever you're trying to accomplish in your business or in your life, the faster you can build trust with those that you interact with, the faster you're going to see your goals come to fruition. So I highly recommend that book. It gives a great overview of the importance of that, because let's face it, if you don't have trust with someone, what's the likelihood they're willing to work with you or advocate on your behalf? And so there are really skills and techniques and things that you can do to ramp that up. So I've got some just for fun questions. Who's your hero and why?
Who's my hero? I probably have to start with my dad. I've watched him go through so many different things in his life. He's 85 years old. He's loving life, and just, he's been through, 15 cervical lumbar surgeries. He was in a head-on collision when I was 16, and used to drive truck for UPS. Excuse me, UPS, and it changed his life because he became disabled, went through 2 years of medical problems, and then he went back to college the same time I started college.
Wow.
He got a business degree, opened up an accounting business, and retired when he was like 70 from that accounting business. Turned it over. My son-in-law, runs that now, and then took care of my mom for 13 years because she had Alzheimer's, and he took care of her as much as he could at home. And then she passed away a couple of years ago. But I tell you what, I think I'd have to say it's my dad.
Yeah, that's awesome. What talent do you have that most people don't know about?
Oh my gosh. What talent do I have? I'm not even sure that I have one. What I really like to do, which I have not been able to focus on, I like taking old things and then bringing them back to where they were.
Restoration.
Yeah, restoration. And of course, the last, I don't know, a few years, I just haven't been able to do that. But I love taking, whether it's furniture or like I did a 1940 Ford Ferguson tractor. That was a family heirloom that it was going to get hauled out to the junkyard. I told my brother-in-law, stop, get it off the trailer. I'll figure it out. But I don't let that first tractor that was in the family go to the junkyard, and I got that all working, and now my son-in-law has it on his farm. That's probably something I like to make things better. And so I look at that and I can see, and it relaxes me to be able to do that. So, but I don't know if it's a talent. Okay.
Something you enjoy doing.
But it's something I enjoy doing. Yeah.
So what's the worst job you ever had?
The worst job I ever had, nothing comes to mind. And I've been through somewhat of the gamut. When I was 16, I worked at a movie theater, concession stand. Then I was a projectionist. When I got into college, I worked at a soil lab and did a lot of plant work and measuring for soil scientists. Worked my way through college. When I got to chiropractic college, I worked in McDonald's, and I was flipping burgers, to make money. I became a swing manager. They promoted me to a swing manager. I did it on weekends, so I got up at like 4 a.m. and worked till 3. And you just do things you need to do. And then I worked at Abbott Northwestern Hospital in the Twin Cities when I was going to school at Northwestern. It kind of went from McDonald's to that. It was a big pay difference, better hours. And then what happened was that I lost, there was something that happened on my loan at the school, didn't go through or whatever. So then I only had like a year and a half left and I couldn't stop. And we had a child, I was married. So I took a full-time, talk about crazy, night auditor position at the hospital. And so I went to work at 11 at night, got done at 7 in the morning, got to school at 8, went to school till 4, went home, ate, and slept for 3 hours. My wife literally dragged me out of bed to do it all over again, but you do what you need to do. And then I started practice, but I can't say that I had a horrible job. I'm grateful for every job experience I ever had, really, when I look back at that.
Yeah, we're all the sum total of everything we've ever done. And sometimes
Right.
we have jobs that teach us or tell us what we don't want to do the rest of life. But I got to ask a question about McDonald's experience. Did the milkshake machine work back then?
Oh,
Because I
yeah.
have to find a milkshake machine at McDonald's these days that works. It's
Oh, ours did. Ours worked great. Too good.
Well, thanks for spending some time with us today, Scott, and thank you all for listening to the ChiroSphere podcast. Please subscribe and share the podcast with your friends and let us know who you'd like to hear from in the future, what topics you'd like us to cover, and we'll do our best to deliver. Doctors, if you offer discounts of any kind in your office, you need to make sure you're not breaking state and federal rules and regulations on dual fee schedules, inducements, and anti-kickback violations, which can lead to serious fines and penalties. As a member of ChiroHealth USA, we can help eliminate these concerns by using our profitable discount strategy. This strategy ensures that any discounts that you offer are 100% compliant and, most importantly, profitable. It all starts with a no-cost, no-obligation phone call to find out if we can help you, like we have thousands of other doctors nationwide. Many of our doctors have seen a 20% increase in their revenue and a 50% retention of patients who are part of our network. Over the last 17 years, over 7,000 chiropractors have helped over 4.3 million patient family members get the care they need at a cost they can afford. If you want to increase your revenue and retention and practice with more peace of mind, call us at 888-719-9990 or visit our website at chusa.com. That's CHUSA.com to find out why ChiroHealth USA is the network that works for chiropractic and you. Thanks again, Scott.
Thank you.